Hello, and welcome to my next Executive Series video. Our topic is biological indicators. Aaron Snyder here from Quality Systems Explained, where we make quality systems simple for you. If you're new, make sure you subscribe. Check out the status bar below for our agenda. Stick around till the end for the 3 bonus questions. Our topic, biological indicators, is covered by 1345 sections 7.5.2 and 7.5.7. There is a standalone ISO standard 14161, sterilization of healthcare products, biological indicators, guidance for the use, selection, and interpretation of the results. Biological indicator in 5 words. Most difficult microorganism to kill. Biological indicators, commonly referred to as BIs, are a product that contains a specific microorganism at a designated quantity. BIs are placed within a sterilization cycle to challenge the lethality of that sterilization cycle. They are spore tests that are used to monitor the effectiveness of our sterilization process. There are many different kinds of BIs that come with different species of microorganisms. These microorganisms are the most resistant microorganisms to the sterilization process. The BI that you select would need to be the best suited or most resistant to your sterilization process to ensure effective and adequate monitoring. For guidance on this, look at ISO 14161 for the selection, use, and evaluation of the results for the different biological indicators out there. The biological indicator will be placed inside the sterilization cycle, likely at one of the more challenging points within your product, and then after the sterilization process, that biological indicator would be tested and the results evaluated. So how do I know this is working? First, the biological indicator that I select is the right one for my sterilization process. Second, my processes around handling, evaluating my results, testing for my BIs follows ISO 14161. Third, I have documented procedures that outline how I handle, purchase, test, evaluate my biological indicators. And then finally, my processes also outline where I place the biological indicators within my sterilization cycle. So how do I know this is not working? First, my BI selected is not the right one for my process. Second, my process for evaluating, selecting, and controlling my BIs doesn't follow 14161. And then finally, I don't have any documented procedures outlining all of the requirements for handling, placing, locating, collecting, and testing my BIs. And now for our 3 bonus questions. First, what BIs do we utilize within our sterilization processes? Second, who do we purchase these BIs from? Can I get a list of those suppliers? And then finally, where are the BIs placed within each sterilization load? Can you please show me? Thank you for watching. Please like, subscribe, share, and comment. Send any questions to me at qms.jedi@gmail.com. This is Aaron Snyder from Quality Systems Explained, making quality systems simple for you.